everyone, welcome to ResearchMD.com. This is Dr. Pramil Chariat. I work as a Chief Medical Officer in the United States. So we're going to do a series of lectures on common physician mistakes, are very detrimental. These are gross mistakes you can avoid if you know the pathophysiology behind it, okay? So what's going to happen when we make a huge mistake? Somebody's going to die. And then when patient dies, we can't sleep at night, right? And then what's going to you get a call from the lawyer, right? And the lawyer is going to sue you. And what's going to happen? You're going to lose your house. What happens next when you lose the house? Who's going to leave? Your wife is gone, right? So we need to know all of this so we can prevent making mistakes, so we can keep our house and our wife. Okay, so now let's look at I'm going to talk about rhabdomyolysis and the role of calcium. Very, very important, my friends. Okay, there are two. First, what happened in the rhabdomyolysis? There's something called early phase and the late phase. Let's look at the early phase. What happened? Disruption of the muscles, muscle damage, inorganic and organic phosphorus component dissolved in plasma, and that causes hyperphosphatemia, okay? This hyperphosphatemia causes deposition of calcium phosphate into the muscles and the other tissues. So what happens? Then you're hypocalcemia. There's decreased calcium in plasma because of the deposition of the calcium phosphate on the muscles and the other tissues. So initial phase, you're going to see a hypocalcemia. And then there is a late phase. What happened to the late phase? You got calcium deposited in this damaged muscles, right? This because of the hyperphosphatemia. This start releasing into the ECF or the plasma, and then it causes hypercalcemia, my friend. Okay? So what happens? You started treating hypocalcemia, you got hypercalcemia already developing, you give him more calcium, patient is going to have arrhythmia, and they're going to die. So be very careful. When you see this hypocalcemia, remember it's only transient, so don't jump into giving IV calcium. Just give some IV fluid. That will probably fix it, okay? Unless like some major arrhythmia kind of develops and all that. We also want you to tell about another situation, about hyperkalemia. What happens in the rhabdomyolysis? Damaged cells, breakdown of skeletal muscles. You got release of intracellular contents. And what happened? Increased potassium release into the ECF, you can have hyperkalemia. So you looked at the lab and you see the potassium is like 6.2. You got an EKG and it shows like tall T waves. What's the next step? You're always thinking about giving calcium gluconate to stabilize the cardiac muscles, right? But don't do it. What happens if you give calcium to these people? You already have hypercalcemia, right? More arrhythmia, patient is going to die. So the best thing to do in this situation, avoid calcium, but give insulin, nebulizer treatment, and caxolate, those kind of things, but don't give calcium, okay? So it's important, my friends, in rhabdomyolysis, think about calcium and the pathophysiology. This will this help you to save your patients and prevent lawsuits, so you can keep your house and keep your wife. Thank you for watching.